Now we have Ann Nyman from Sweden. She's from the National Veterinary Institute, and she's going to present a paper entitled Antimicrobial Resistance in Large Swedish Dairy Herds with High or Low Calf Mortality Risk. So you're very welcome.
Thank you, Mr. Chairman. And as you can see, my name is not up on this slide, and that's because I'm not involved in this project. I'm here on behalf of Maria Torsein, that unfortunately couldn't come here today. But I know that she wanted to acknowledge her co-authors, Ann Lindberg, Charlotte Hallén Sandgren, Katarina Svensson, Ulrika Grönlund Andersson, och Charlotte Berg, that has been participating in this project. So, as the chairman said, I'm going to talk about the antimicrobial resistance in large Swedish dairy herds with a high or low calf mortality risk. So back to the basic and not about behaviors of people. Calf mortality is reported worldwide to be an important cause of economical losses in dairy production, not just because of the loss of the calf, but also for herds that recruit their heifers. They will lose a possible new heifer. And also a high calf mortality is an indication of a poor welfare in a dairy herd. So it's an important issue. The main cause of calf mortality is respiratory diseases and gastrointestinal disorders. And in previous studies made by the main author, that was a part of her PhD project, she has seen that high calf mortality risk is associated with higher antimicrobial use in the on herd level. As commensal E. coli can acquire resistant genes or develop resistant mutants, these E. colis are regarded as indicators of the antimicrobial exposure of their host. That is, evolvement of resistant bacteria is driven from the use of antimicrobials. And the aims of this particular study was to evaluate the treatment, if treatment or management regimes at herd level was associated with antimicrobial resistance in E. coli at the individual level. They also wanted to evaluate if risk factors for resistance were associated with type of herd, and that is these high or low calf mortality risk herds. The inclusion criteria for the herds was that they had to be affiliated to the Swedish official milk recording scheme, and that they should be large in a Swedish context, and that is that they should have more than 140 cows in the year 2003 and more than 160 cows in the year 2005. And for logistic reason, as Sweden is a very long country, we choose just to have the farms in the southern part of Sweden, where they also are closer together. In total, 160 herds met these criteria, and they were ranked according to calf mortality, with the 40 with the herds with the highest or lowest calf mortality were contacted and asked to participate in this study. And in total, 30 herds with a low calf mortality and 30 herds with a high calf mortality accepted, it should be high there, accepted to participate in the study. And the study's design was that it was a case control study. And the dependent variable in all statistical models was antimicrobial resistance to one antimicrobial substance, and that was yes or no. And in all these models, the variable type of herd having high or low calf mortality risk was forced into the model as a fixed factor. So every herd was visited once during December 2005 till March 2006. And at the visit, up to 5 fecal samples were collected from calves 1 to 14 days of age that visually appeared to be healthy, but they could have any consistency of the feces. The fecal samples were analyzed for fecal pathogens, and therefore a risk-based approach was applied. That is, diuretic samples were sampled in priority. And also, if the calf had been previously treated with antibiotics, they were excluded from the statistical analysis. At the visit, an interview-based questionnaire was filled in together with the farmer. And then in 2008, they had a follow-up questionnaire by phone, but not all the farmers could or were willing to participate in 2008. And the results from these questionnaires were merged into one data set and used in the statistical analysis. The data was on herd level, and they started out with an unvariable screening of the data from the questionnaires and the treatment and management variables. An example of these could be if the calves were fed waste milk, or if they were given milk from cows that were currently on antibiotic treatments, and also about the dry cow, how dry period antibiotics were used. And the variables with a p-value of 0.2 were considered for further analysis. And in the second part of the statistical modeling, multivariable logistic regression was used, and they had 6 models. And it was 5 models with the most common, the antimicrobials with the highest prevalence of resistance, 1 model for each of these 5 antimicrobial substances, and then also for a multi-resistant model. Now it's really fallen asleep, or? So, to the results. The calf mortality risk in high mortality herds was 9% in average, ranging from 6 to 24%, so quite high. And in the low mortality herds, it was just 1%, ranging from 0 to 2. And the median age of the sample calves was 5 days. And here is the table of the 5 most, the substances that was tested and had the highest frequency of resistance. And you can see it's ranging from 40% to 65%, so quite high frequency of resistance for these substances. And in all herds except for 1, E. coli isolates showed resistance to at least 1 substance. And then they made these all multivariable models, 1 for each of these 5 substances, and actually no variables remained significant in the nalidixic acid model, so they hadn't found any factors associated with resistance to nalidic acid. So more research is needed there. But for sulfamethoxazole, some variables became significant. Especially, it was a higher odds for resistance if the sample came for a calf that had diuretic or a loose consistency of feces. And the odds was almost 5, so quite high risk there. And also, the symptom to start an antibiotic treatment for respiratory disease, the choice of when to start the treatment was also associated with increased resistance to sulfamethoxazole. And for the farmers that set in antibiotics already when the calf was just coughing, it was a higher odds of having E. coli isolates resistant to sulfamethoxazole compared to those farmers that waited until the calf had fever. And also using  as a first choice drug for treatment for diarrhea, it was reduction in risk or odds for those herds that had that choice. Type of herd being a high or low mortality herd was not significant in this model. For the streptomycin model, again, having a diuretic sample had a higher odds for the E. coli to be resistant to streptomycin, and also for the choice of starting an antibiotic treatment, the odds was almost 5 for the herds that treated when the calf only coughed or had a coughing, and compared to those that started a treatment when they have fever. And again, being a high or low mortality herd was not significantly associated with the resistance to streptomycin. Same model again, almost. Resistant to tetracycline. If the isolate came from a diuretic sample, it was an increased odds of resistance. And again, type of herd was not significant. And here is also the same results almost, but here if they have sulfa as a first choice drug for treatment of diarrhea, it was an increased odds of resistance against ampicillin. And the final model, where they used a multi-resistant model, if the isolate were resistant to more than or equal 5 substances, again, if it come from a diuretic sample or not, was associated with resistance. But here, actually, type of herd also was significantly associated with a multi-drug resistance. So, in conclusion, antimicrobial resistant bacteria was significantly more common if in calf fecal samples with loose consistency, and herds with a high calf mortality risk was significantly associated with several severe multi-resistance. And the thing is that these calves from which the isolate came from, they hadn't been antibiotic treated. They were not selected in this model. So there are other factors, other things in the herds that get these E. coli being resistant that we don't really know about. So thank you for listening, and I will probably not be able to take any questions.
Okay. So thank you very much to Anne.